Hello and good morning, everyone. Welcome to another edition of the Meet a Professional series or MAPS. My name is Matthew Garcia. I'm the Associate Director for Employer Relations and Alumni Programs at the Shavit Glaubeck Center for Career Strategy and Professional Development. I'm joined today by Dr. Todd L. Schlesinger, who is going to be talking a little bit about his career, but a lot about his lens that might just support how it is that you're navigating towards a career in health, medicine, and the like. So without further ado, Doctor, why don't you tell us a little bit about yourself and what influenced you during college to enter your field?
Sure, Matthew. Thank you so much for having me. It's a real honor to be here, and give you guys some advice and try to help out. I grew up in the Northeast and spent most of my time there. I ended up going to college at University of Chicago. Part of that had to do with a scholarship opportunity that I took, and from there, in terms of going into medicine, I think coming out of high school, I had an interest in science and math, but I also definitely had interests in architecture, actually, of all things. Um, I think you never know where life will take you, or what Hashem's plan is. But when I got to college, they're like, "What do you want to major in?" And I was telling the advisor between these two things, and they're like, "Well, we don't have architecture as a major, so I guess you're stuck with bio." Um, you know, Probably I'm an only child, so I think it made my mom happy. And you figure as a science major, good Jewish boy from the Northeast, you probably should end up being a doctor. But a lot of times people are like that because you know what you're good at in school, right? You know what classes, I was good at math, I'm good at science, it's go to good schools, but having good grades and all that doesn't necessarily, although it's partly necessary to get into medical school, doesn't mean you're going to be a great doctor, that it's the right career choice for you. You start out doing the things you're supposed to. I did some biology research and a neurology lab, which was fascinating stuff. And that helps you, I guess, learn scientific method and things. But again, it's different than actually taking care of people. And I think, what started to hit home for me is some of the groups I was involved with, we did a lot of volunteer work. We're taking care of folks that were underprivileged, underserved communities. And I think that's an important thing because, forget the science and, treating diseases and illness. A lot of medicine, it really is caring for people. And I think once you see that that's something that you're really good at and, you get joy from in terms of interacting with other people and seeing that the hard work you're doing is helping them, that definitely, I think, helps set you in the right track. Specifically in medicine, but very specifically for emergency medicine, one of the bigger things in college that really had a major influence when I was like, oh, I know what I want to do is I did an EMT course, an emergency medical technician course, and I was in Chicago, and Chicago, historically is really well known for its EMS services. And it was fun because it was the class was not everyone was college educated, from a science point of view, all that stuff. I knew that, I mean, it was easy, but it was nice because you met a lot of people who, different backgrounds and stuff that just wanted to help people. And then, as a emergency medical technician, you're out there, you see people, in the crux of emergencies, and you're taking them to emergency departments, and you see all the mayhem that goes on in emergency medicine and the different types of patients and all that. And I mean, for me, I was like, this for me is really a calling, um, and really, really enjoyed it. I remember like so many of those experiences. I mean, because it's almost 30 years ago, are still like fresh in my head, and it's stuff that I never would have seen, stuck in the confines of the college campus and the other things that I was doing. And I did all the other stuff that, they say you're supposed to do, but I think it's really important to know that this is something you're going to get joy in, because if you have a passion for something, for a field, it stops being work and it starts being fun, everything you put into it.
Thanks very much. I really appreciate it. What should our audience know about the field that goes beyond what they might learn in their coursework?
It's a great question, and interesting. Like coursework, in college is really limited to, if you're going into medicine, to basic sciences. And you need that background, but it doesn't really tell you much about medicine. um, I guess you could always say just plenty of stuff on TV. You could watch ER, you could watch Grey's Anatomy. I'm just kidding. A lot of good shows out there that I guess show the crazier and more the the fun stuff that you can tell stories about. Though obviously that's not really all what medicine is. For me, just so if anyone's curious, I'm an emergency physician. My training actually, I did residency in emergency medicine. I also did extra fellowship training in critical care medicine. So I split my practice in my early career between taking care of patients in an emergency department and taking care of critically ill patients in the intensive care unit. Emergency medicine itself, for those who don't know, is its own specialty, right? A lot of the TV shows, they always make fun of it and stuff, but it actually is its own separate specialty in medicine. It requires a 3-year residency. Right now, my job is actually, I'm a program director, meaning I run a residency program, so I have 36 doctors that all just graduated medical school, and they're training under me. So it's like when you come out of medical school, you're not, although you're a doctor, you're really not an expert in anything, and it's hard to even get a job. You need to have that extra training, or which is like an apprenticeship. And residencies can vary from 3 years in internal medicine, and I'm, as I said, 3 years in emergency medicine, to OBGYN it's like 4 years. Most surgical programs are 5, though many can go to 7 when you add research to it. I believe neurosurgery is 6 years after an internship. So it's a long time of training. While you're a resident, if you don't know, you get paid, but you're not getting paid like normal doctor salaries. So it's a big commitment. Because you have college, which obviously costs a lot of money. Medical school, if you don't go to a state school, you can build up a lot of debt. Most people coming out of medical school have almost $250,000 in student loan debt, if their family couldn't help them along the way. And that's a serious concern. When you're a resident, most residents get paid in the $50,000 range. So what happens is you're not done with your training and getting your first job till you're probably over 30, like 31, and that's assuming you went straight through, right? And most of the folks that go to YU will also maybe have an extra year in Israel. So you may not be 31, 32 years old till you're actually getting a job where you're getting paid, um, a more traditional doctor salary. And there's a lot of debt that's associated with that. And, it's something that it's a big decision. It's something that you have to really say, is this what I want to do? It's a lifelong commitment, and it should be something that you really, really love and enjoy doing. Um, a little more just on emergency medicine, it's not just working in an emergency department. It's not, again, just like what you'd see on TV, but it's really the treatment of what I'd say the undifferentiated patient. You really have no idea what's going on. I joke around, I always say it's like the all you can eat buffet of medicine, because you come to work and you don't know, maybe you'll have a heart attack, maybe you'll have a stroke, maybe, someone might, just have a twisted ankle, a splinter, it's everything. You'll see like some of the worst things out there. And then there's a lot of joy in saving people's lives. There's a lot of, minor surgical procedures that we do. And it's fun because, instead of, for me, where in some places you become a super subspecialty expert in a field, for us, we really have to know every aspect of medicine, almost every field, and all the growing trends, and sort of know what to expect. So if you had some new surgery that was just invented last year, well, I should know at least the complications if something goes wrong. Um, Emergency departments are open 24/7. They don't care what insurance you have. So, in the United States, where there's a large amount of the population's uninsured, we become the safety net. So you can always, if you have nowhere else to go, and this is true for a lot of people, especially in underserved communities, homeless people, people from other countries, undocumented aliens, that's the only place they can get help. And I think that's one of the nicer things about it, because, I get paid a nice salary, but I don't think about each patient, do they have insurance or not? We don't care because it doesn't affect us. Um, And it's nice to be able to sort of go and clean and say, I'm going to take care of these people. And I don't care if they can pay or not. And sometimes, you're the only person that can help them. They may want to go to a specialist, they might want to go somewhere else, but they might, if they're, they can't afford it, or they don't have the education to know where they go, or they don't have the access. You're maybe in some parts of the country where there aren't access to specialists. That's the one place where the doors are open 24/7, and we're always available. And it's fun because every day at work you have no idea. It can be very, very um, different. And you also have to, it can be very hard too, because it's not like there are no appointments or schedules. So on average maybe I'll see 2.5 patients an hour, but like on a regular shift I might see 7 people in 1 hour and then one person the next hour, because you don't know. You could have a mass casualty incident. And now in the world of COVID-19, and it's been a very challenging year, because we were the first ones seeing all these patients who are in a lot of distress, and not having all the answers and trying to figure it out, and making sure you have all the, whether it's PPE or equipment you need. It's really fun. It's I could go on and talk about the specialty forever. It's something that I enjoy doing, but I think I'll I'll leave it at that for now.
Thanks very much. How can a student best inform themselves of shadowing, internships, any hands-on experiences, and more to prepare them for medical school?
Um, Great question. Preparing it's a little different now, right? Like Corona changed the world in so many ways. And one of the harder things to do is shadowing, right? Shadowing and volunteerism and all that, although that was always a part of medicine, people liked it because, um, at least so far, with the risks of COVID-19, and even though those risks are low for college age students, assuming you're in normal health, a lot of facilities and offices don't always want to take the risk. It's true, even like pre-corona, when you volunteered in a hospital, they always wanted to make, you always had to sign waivers, because, God forbid you picked up tuberculosis or some other type contagious disease, although those are rare. Now, because being that COVID is so contagious, it's been hard. Like, we closed our doors to volunteers in our hospital in Florida, and a lot of offices have done the same thing, and a lot of it has to do with liability. So I'm telling you, it's not good. The question is, what can you do? I mean, I definitely would ask friends and family. I would always, I think, in most hospitals, start with the volunteer department. Things are starting to ease up. People are starting to get vaccinated. Programs are starting to open. And volunteering at a hospital is a great way to get in the door. Even if at first maybe you're just helping push people around or passing around magazines, that's a way you can start to meet people. And it's a way you already have the ID and the screening and everything. Because it's not like I can just say, hey, you know what? Oh, you want to shadow with me? Come with me. We could get, you just can't do that because there's privacy issues and all that. So everyone who comes into a hospital has to be screened. You have to be educated in patient privacy. You have to be, they have to make sure that you're not sick or contagious, or and that the risks of being around folks in a hospital. And that's usually the simplest way to sort of get the foot in the door, where you'll have the ID, you have the screening and all that, and then you can start to get to know some folks and maybe be able to shadow. Shadowing is nice because, again, it's similar to what I was saying with college experiences. It's not the classroom, it's not just science, it's dealing with people, and seeing if that's really the right thing for you. Um, so I think that's starts to be a good thing. I would say, though, for sure, and something that is really underutilized, is joining appropriate medical societies. Like, anyone interested in medicine should join or sign up with the AAMC, the American Association for Medical Colleges, where it's the organization that, um, I guess, helps credential all the medical schools. But they have a lot of good information there that helps guide your path from college student through medical student to residency. That's a good start. Every medical society, like the American Medical Association, they have student memberships, and these things tend to be really cheap. It's not like, I might pay $500 a year for that. Most student fees are like, in the 25 to $50 range. And a lot of them will say, they're for medical students. I wouldn't let that stop me. Like if it's just like, oh, here's our medical student thing, because medical students obviously are going to be interested and want to join the AMA. It doesn't mean they don't want college students. If there's a question you can ask, like some might say, what school are you in? So call and ask. And I know some of them may not allow it, but it's a really good way to begin. If you know there's a certain specialty you like, I'm in emergency medicine. There's the big specialty societies for that are like the American College of Emergency Physicians. And this is true for every specialty. They'll have a main society, but then they'll have a resident society. Like in ours, it's the Emergency Medicine Residents Association. And all of those together will have a medical student division. And I'm telling you, it's one of the things that all of us love. And it's nice when you see younger people that are enthusiastic and excited and optimistic about their future and about medicine, and that have energy and the time. It opens so many doors, because it's not just being part of it, but you can see, oh, maybe I'll join a certain committee or be part of a group. And then they're like, oh, we need help with a certain project. And all you have to do is raise your hand. I mean, I've done tons of things in my specialty that helped me, get to the position I'm at today. And all of it was just, it started out really simple when I was, young, and I just raised my hand and said, oh, I'll do that. And then you meet some people, and then, okay. And the most important thing, though, is not to get, if you say you're going to do something, you have to do it and follow through. That's a big deal. Like a lot of us can sometimes get overwhelmed and join too many things, so you don't want to do that. But I think it's really, really important to get, from an information point of view, to look, especially at the AAMC, at relevant medical societies, and also in the States, right? So if you guys are in New York, and you like emergency medicine, well, the New York chapter of the American College of Emergency Physicians is very active, and they have a huge student population that comes there. And, and a lot of them, like in Florida, you could go to the conferences for free, and you could show up and meet people. And then the next thing you know, maybe you're doing a research project, and it's just about being present. And so much of medicine is really, it's a people game. So it's getting to know people, making connections, and not being shy.
So you're mentioning a lot of these experiences that are a little bit different nowadays, but that are still important to get. Kind of shifting gears a little bit, what are some of the most valuable technical and soft skills that students should be working on right now, either in these experiences or doing other experiences?
Great question. You know, when you're applying to medical school, right? Because you guys are in college, you're applying for medical school. There are a lot of good people out there, and a lot of folks applying. And I know that, right? I run a residency program. I take 12 people a year. I get 1,000 applications, for 12 spots. That's a lot of work, and you want to read everything and go through everything and do it, and you try. But you know that, there's only so much time in the day. So you're going to look for simple things to kind of just filter it out. Because you can say, although at an individual level, like each person on this call might, they're amazing and awesome, have done great things, and their parents love them, and it's great, and you're going to all be successful. You know, I always say, put yourself in the other person's point of view. So if you're on a med school, and I've been on a couple med school admissions committees, you have thousands of people applying, and they're all awesome, great, nice people, so how are you going to figure out who you really want to spend time reading and looking and learning about? And that's why, like, first and foremost, doing well on tests and getting good grades is really important, because when you have 1,000 plus applicants, you're not necessarily trying to find the best. The first thing you're going to do is, how can I get rid of half of them? How do I just make my pile? How do I cut it in half? And I, like, at a personal level, I don't really like to do that so much. But like, the honest truth, in most admissions committees, you'll say, you know what, let's just draw a line in the sand. And if you need an MCAT score above this or GPA above that, because if you set that, it's done, right? You can thin it out and then look at a more reasonable pile and sort of say, okay, who do I want to interview? Who do I want to get to know better? Who do I think will be a great fit in my school? So that's first of all. Like, I'm telling you, doing well on the tests can sometimes be enough to cover everything else, but then once you get past that, then they really want to get to know you. And so what are they looking for? And again, I don't need someone who, like right now, because let's say to get into my residency, that would be maybe 6 year, 5 to 6 years away from where most of the people on the call are. Like, I don't care what you got on your MCAT anymore. And I couldn't care less if you did well in biochem or OChem. And I probably would fail all those tests, even though I did really well on them in college, right? What I'm looking for is someone who's going to do well taking care of people, right? And that's what medical schools want. They want to see someone who's caring, who knows how to interact well with people. And that's where the next stuff comes in. So the better answer to your question, I think everyone knows you have to do well in MCAT. Leadership experience is nice. It shows, again, that you're thoughtful, that you can make decisions, that you can achieve your goals. So, if you're in a club and you can lead it or do something, and it doesn't have to be medically related, but people want to see, wow, you have passion about something, where you're not just, idly sitting by, but you've done something to accomplish something and get a goal and make a difference in people's lives. And again, it doesn't have to be medical. The other thing is, because you're dealing with people's customer service experience, right? And again, not everyone has the same opportunities. But I'll tell you, when some of the folks I remember interviewing for med school that impressed me the most were people that just worked in their family business, but worked hard. Like someone who's like, oh, my family, came to this country, were poor immigrants and had like a dry cleaning store. And so my whole life from when I was, 10 years old, all I did was work there, right? Now you could turn that into a sob story, and no one wants to hear a sob story. But if you say, wow, you know what? I learned how to deal with people, and that were, sometimes we were mad, sometimes we were angry, sometimes we wanted to keep secrets, like you can think of all the crazy stories that come to a dry cleaner. And I'll never forget, they spoke about it so well, and how they were able to solve people's problems and make a difference in people's lives and make them happy. And if you can express that when you get to an interview point of view, showing it doesn't matter if as much as, oh, I worked in a fancy lab or I shadowed some fancy professor. Those things are nice things too. It's how you project it and how you talk about it. I just want to see, do you care about other people? And does that bring joy to you? And is that something that you really want to make the mission of your life? And with that comes hard work. Like going to med school, it's not easy. I mean, it's 4 more years of schooling and hard work and tests. I mean, you're asking for a life full of constant tests that go on forever. I just did another, right? I'm 49. I had to take a major test last year, which, but it's fun. I mean, again, you get used to it. But that's what I'd say: showing that you're passionate about the field you like, caring about people. Like, never ever, when you get to the points of interviews, talk badly about other people, or especially your family. You know, I always say, if you can't care about yourself or the people that are close to you, how are you going to care about people that are in need and coming to you? So those are, from a soft skill point of view, that's, I think, really the most important. And you can turn any experience into a positive experience. It's just how you express it.
Thanks very much. I appreciate you being so candid. I'd love to know what your typical work week is like.
Ah, my week is not very typical for an emergency physician. Usually in emergency medicine, most people like it because it's shift work. You're going to do a 8, 10, or 12-hour shift, maybe 2, 3 times a week. And then in emergency medicine, you're not usually on call. So you work hard when you work, and when you go home, you can do other things. And so you would think it would attract people who, maybe want to do, work a lot for 2 weeks and then take time off and do other hobbies, or do stuff. Maybe you want to be home and be with the kids, stuff like that. In a normal situation, it's very nice. From a lifestyle point of view, there's a good balance. My work week's a little different because, as I said, I run a residency program. So I don't work clinically as much. I basically see patients mostly on Mondays, is my clinical day. But emergency departments are open 24/7, 7 days a week. So I do work some nights, I do work some weekends. But the rest of my week has to do a lot with running my program, administrating, and teaching. So, for instance, Wednesdays are our didactic day. So, when you're in residency, it's not that you're just shadowing people like an apprentice and helping out, right? Every residency program, regardless of specialty, has a didactic educational curriculum. So, usually, some places just do 1 hour a day. Most research studies in adult learning will tell you that it's better to compress it into a single half day. So that's what we do. So, like for instance, today from 7 to just before this till 12, we had 5 hours where we had different styles of lectures. Um, Not that I gave them all myself. I have a faculty that works under me, and so right now we're working on the gastrointestinal system. So we did a bunch of different types of both talks and small groups and board prep. So my Wednesdays are pretty much done with teaching. Tuesdays and Thursdays, I'll do a lot of other meetings. So it's I mean, I love what I do, and I'm really dedicated to the field. So yesterday for me, like I'm on the board of directors of the Florida College of Emergency Physicians. So I had committee meetings. My life is turning into a Zoom life, which is a little harder to get used to because it used to be I could go travel and at least see my friends. And that's a lot of fun, part of and doing the other stuff like that. As I said, it's making sure all my residents are okay. It's a lot of paperwork, going over progress reports, but we also do research. So it's completing research projects and trying to help make sure everyone's getting jobs. It's a lot of administrative stuff, seeing what kind of problems are going on, and then other things within the hospital in terms of a lot of different meetings. So for me, my week is, again, I'll see patients about 1 to 2 days a week, and the other days I'm either teaching or going to meetings or doing some scholarly activity or talking to guys like you. And it's fun. So for me, it's right now my lifestyle, although it's probably more hours in the week of work, I have a little bit more of a set schedule. So compared to earlier in my career, um, it was crazier. I worked a lot more nights and weekends, and you have a little less control when you are not working. But at least when you're off, you're free. But it's definitely something to consider in some other specialties where maybe you're going to work Monday through Friday, but you're also on call for your patients 24/7, or your partners. And it's a lot like that, medicine, it's not typically a 40-hour work week. It's almost always a bit more.
Got it. Thank you. I appreciate it. You mentioned earlier a little bit in connecting with others in the field. How does one effectively network?
Yeah, so I mean, networking, and again, this leads into what I was saying before, stuff you should start doing now. Um, Really, that was the answer, is getting involved in different types of medical societies, going to conferences. Now it's actually, from a conference point of view, it's easy because everyone has virtual options. I mean, now most of them are just virtual, but you can easily go and you can learn and sort of see, is whatever specialty you like the right field for you. But and again, because it's so affordable at a student level, I did that really early on. Like from the first day I got to medical school, I joined like the AMA and the New York Medical Society. I went to medical school at Downstate in Brooklyn. So I think I still get emails from like the Medical Society of the County of Kings, from Kings County. And it's fun because you meet, folks, with similar interests to you. You see what's going on in the field. You keep up to date with research, and that every one of these things, it's not, they'll have specialty interest subsection. So I really liked critical care. There's a critical care section at the American College of Emergency Physicians. So I went to the first meeting. I'm like, let me go to this section. And back then it was a new idea. So I showed up and there were 6 people there. Right. But it was 6 people I didn't know, and they all had really similar interests. And I'm still friends with them to this day. And they're like, oh, we need someone to represent us on the council. Like, is anyone free next week? I'm like, okay, I can do it. And next thing you know, I was on the council. And then when you're on the council, I was there with all the people that were representing all these other things. I got to meet like 300 people that were interested in leadership stuff. And just so you know, I've been on the ASIP council now this will be my 21st year this year, because it was something I really enjoyed. I had other opportunities where I went to it and I'm like, I don't really want to hang out here. But it's definitely an amazing way. Like to really meet people and connect with people that are distant from you, you know, and that's what it is. Like if you ask me right now, and definitely what I do is a little bit more than most, but I'm like a member of the American Medical Association, the Florida Medical Association, ACEP, which is the American College of Emergency Physicians, their Florida chapter. I'm on the board of that. The Residents Association, just because I take residents. There's a Society of Academic Emergency Medicine, an American Association of Emergency Medicine. I'm members of all of those. And then in critical care, there's a Society of Critical Care Medicine and the American College of Chest Physicians. Um, you could say that's a lot. 8 medical societies gets a little expensive, but for me, with my diverse interests, it's really, I mean, A, my work pays for it, but B, it's fun and you get to meet diverse people. And, in each one of those things, there's one thing I do. Like I don't try to do a lot, but I'll say, I will, with these guys, I'm going to be part of this committee, or in this one, I'm going to work on this one project, and then learning how to, as you get a little older, how to say no at times is important. But, you never know. Like I'd say make sure your social media is appropriate and professional. Most people will start making a LinkedIn account. You'll never know, you know, do I put a lot of stock into that? I don't know. But if someone if let's say I meet someone on this call and I'm like, I don't know, you ask a good question, maybe I look you up. And, if something shows up, you remember it. It's important. In medicine, everyone's part of Doximity. It's sort of like a um, LinkedIn just for doctors, but that only applies once you've completed medicine. But definitely, and I was hinting at it from a networking point of view, the opposite part is making sure your social media is really clean, you know, because as I said, right now you guys are in college or whatever, people can have fun, do some different priorities. 5 years from now, you could be in residency and it's a different story. And you're seeing a patient, and the next thing you know, they Google you, and there's some crazy picture there or something. I think and it's really important to, I think, be careful in those situations, right? Like I think everyone heard that it was a few years ago. There was a young woman who's a neurology resident at somewhere in Miami who got in a fight with like an Uber driver, and it got all over the internet and stuff. And she actually got fired from her job because of it. So just that's the opposite of networking, but make sure, you want to make sure that what's out there is professional and shows that you're interested in what you're interested in. And that's one of the easiest ways to maintain an online presence is if you join different societies and be on a committee and that. Like if you were to Google me right now, you'll get like, probably like 4 pages of just stuff with the American College of Emergency Physicians. And just because every time your name's on something or even you're on a list of people, it shows up. And those are the things you want to show up. So.
All right, thank you. We had one clarifying question to follow up from the group. It was, what does that mean to join a society practically? Is it like an online subscription or possibly membership? LinkedIn? Where's the practicality and how that happens?
Oh, okay. Yeah. No, so LinkedIn and LinkedIn is just a professional version of like a Facebook or whatever. Those are just a way you can put your profile out there to sort of say who you are, where you went to school, what have you done. People can be your friends or not. In medical societies, you actually have to join them. You have to be a member. It's like joining a shul. Same thing. You put an application. They say, you have to show some interest, and it usually requires you to pay money. As I said, though, for students, it's really, really cheap. Like I think, like the American Medical Association might be like $25. And then what does it give you? You get a membership and passcode. So it's like if you're a member of the AMA, you'll have access to JAMA. Now, I know you guys could go to the library and look up the Journal of American Medical Association, but it's nice if you can just grab it off your own computer and see it. Sometimes for an extra fee, you can get the actual physical journal, but it allows you to be part of, to get all their newsletters and figure out what's going on in the field. It'll allow you to, not just, you say if you want to keep up with like what's going on with coronavirus and stuff like that and the newest practice guidelines, that stuff comes out. And then you also see the subspecialty interests within it. So it's something that you're joining. You're saying, I want to be a member of this. They like it because they figure, if you're part of this and you see the value in that over time, that you'll be a member, once you're a full-grown doctor, and then they'll make some money off of you. And other things that can happen when you're part of different medical societies, you can get, there are different awards, there's different opportunities to be part of task forces and write policies, right? Like if you hear, like, uh, I don't know, I'm trying to think, like an extreme example would be, like in emergency medicine, the college we belong to, they put up practice guidelines, like how do you treat people in pain, for instance, right? And there's recommendations of what you do, right? So I actually was, because of one of the groups that I was on, I signed up and said, you know what, I will lead that project. So then I got to call up all the biggest people and specialize in the world, and then we wrote a 8-page paper that's out there. So what's nice is, I got to meet these really fancy people within the field of acute pain management. Um, but at the same time, by putting all this information together, it got out there where a lot of other doctors and stuff will learn from that. And that's nice. It's one of the things where it's like, it feels good to take care of people and help save lives at an individual level. I will argue that it sometimes is even better from a personal pride and accomplishment point of view to say, wow, I just influenced 40,000 other doctors in the right way of doing something. And so I think those things. So you start with one, but for sure. And again, you guys are still in college, but definitely start with the AAMC. That'll give you all this information on how to apply to med school, what's the path like, what are the timing like, and then they'll have opportunities for you where you could do something, maybe apply for a grant or look at award, or they'll have a conference, and you never know what's going to happen. But if you show up to places, opportunity will present itself, and that's how it is. I hope that answers the question.
Thank you. Appreciate it. So one more question before we get to questions from the group. In general, where do you see the field headed in the next 5 years? And how will you be adjusting to those developments?
That's a great question. Well, that would have been an easy question last year, Matthew. Emergency medicine and a lot of fields have changed a lot. And again, this is another reason why it's good to be sort of connected to other people to see what's going on. In emergency medicine, with the fear of corona, less people have been coming to emergency departments. It's starting to build back up, but when everyone was scared, people weren't going in. You'd say, where are the sick people, right? Where are the people with corona? They're in the ER. Why would I want to go there? I'm going to get sick. At the same time, when you have social distancing and less interaction, it's all the regular things, like no one's playing flag football on weekends and twisting their ankle. People aren't, getting into as many car accidents. People aren't playing, between sports and hobbies and all these things. A lot of that stuff, which was a lot of bread and butter kind of things for us, didn't happen, right? People weren't going out to eat as much. You have less food poisoning and all the things that can come with that. That gets problematic. You're like, maybe that's good. There's less people getting sick, but it's from a job point of view, it's not good, right? When less patients are showing up, then maybe they don't need as many doctors. That's what was one of the bigger concerns early on. Things are coming back, but in emergency medicine, you'll see people are, and you see this in a lot, you're seeing it in New York, definitely in Texas and Florida. There are things called freestanding emergency departments, which are developing. There's it's like a fancy urgent care center that has an affiliation with a hospital. They'll probably have a CAT scanner, like more advanced imaging devices, and it works like an ER, and it'll be 24/7, but not attached to a hospital. So you're seeing these in parts of the country. So from our field, like I'm starting soon to sort of teach my residents what it is to work there. It's similar, but there are differences. You're seeing urgent care centers all over the place, right? I think most of you guys on the call, if you think back 10 years ago, were there urgent cares all over? Not so much. Now they're like on every corner. That's a field that, is similar to emergency medicine. And from a job market, people can be doing that, even though it tends to be more lower acuity stuff. I think what we've learned in Corona is just like now, instead of me, being in person to talk to you guys, right? There's a lot more remote learning and things like Zoom, and you see that with telemedicine too. One of the big things, telemedicine wasn't a really big option. And honestly, it's because he didn't get paid for it. Like, so if we had a doctor visit right now, like Matthew and me, you're like, oh, I'm not feeling well, I have a cough and cold. I would, doctors weren't doing that because there wasn't, the insurance companies wouldn't pay you. They'd say that's not really a visit because you're not really there. It's like a telephone call, it doesn't count. But in the new world of, COVID-19, they've decided, maybe that's safer. It's not perfect, but there's a lot of stuff, we could do over the phone or over video, where I can help take care of you without physically touching you. So that's, sort of a newer area that's developing. And within each specialty, people have to get good at that. The folks that are going to be better at figuring out different ways to do remote care are going to do better. And then the other issue, I guess the last thing, especially in emergency medicine, but in most specialties, is sort of access. And what I mean by that is, right, like most of you guys are in, an urban setting right now, or in New York and whatnot. There's tons of hospitals and doctors all over the place. I would tell you, if you probably went, I don't know, 200 miles northwest, you might have a hard time finding all the specialties. Now take it a little more extreme, go in the middle of the country somewhere, places, remote areas of Iowa, Nebraska, Dakota, stuff like that. There are a lot of hospitals where they barely have any subspecialties. As an emergency physician, when you're there, you might be the only doctor in the hospital. Like, I have a friend who's working in a hospital, and except, after 5 p.m., he was the only person there. So if someone got sick in the ICU, he had to go. If someone came in wanting to have a baby, he had to deliver the baby, and it's like, yeah, I know we know how to deliver babies, but we'd just rather not, it'd be good to have your OB there. And so I think you're going to start seeing, because I think it's a little harder to predict, but in a corona world, people have realized that being really close together and in tight urban spaces really didn't do well. And you're seeing a lot of people leaving the cities and going to the suburbs. And I think you'll see people leaving the suburbs and going to more rural areas. And I think as you start seeing sort of the broader spaced areas start filling with patients, there's going to be more demand for physicians and specialty physicians in those areas. And you're going to see a lot more what used to be a small town city become a very cool place to live. It's like what happened to Austin. If you think about Austin, Texas, 20 years ago, maybe you knew it was the capital, but no one really ever wanted to live there. Now it's like the coolest, hottest place to live in Texas, right? And that's true. You'll see, I think that's what you're going to start seeing is sort of the non-urban space right now starting to fill up.
Got it.
We'll see.
Those were all of my questions. Thank you very much for answering all of them very thoroughly, very candidly, and honestly. I have one question so far from the group, and if you are in the group and you would like to ask questions, you most certainly can send them to the chat. One member of the audience said, you discuss specializations. Is it important to think a lot about specializing while still in undergrad? Is knowing specifically what you want to specialize in considered a plus as an applicant from the med school perspective?
I don't think so. I think some people, if you really, really know in your heart, sure. If you don't, because then it'll be believable. It's hard though. You need to have some real experience that would tell you to do that. I would tell you as an applicant, always try to think, what's the person across the table looking at? What's the person on the admissions committee looking for? And I will tell you, right, I've read like thousands of personal statements, and I've talked to, thousands of folks that are interested. We get really, really good at that. You can tell in a second if someone's being real or if they're, not, just saying something that's trying to impress you. I'm trying to say it in a polite way. And that's really important. You want to be very honest. You want to be really mature about it. And so if there's something, if in your heart, I don't know, that you want to be a cardiologist because your family's taking, you've seen your father or your uncle who's done that, and it's, you love the heart anatomically, and it's this, and that that's you. Yeah. But I'd say most people who think they know what they're going into will probably change their mind. So when you're applying, unless there's some really compelling reason, I would just say that you're open to different things, but you can sort of narrow it down. Like you don't want to be too blah. You can say, like I'm a hands-on person. I like the concept of fixing people. Maybe I could see myself doing a surgical subspecialty. But know that, like for instance, in OBGYN, there's lots of surgeries. Like in emergency medicine, there's a lot of procedural based things. You can know that in radiology, even there's a lot of procedure based stuff. You want to have I think it's more important to know what is available. I think most people think they know, like, because what you know from TV or maybe from family. Everyone knows they're cardiologists and gastroenterologists, right? Everyone knows they're ear docs and trauma surgeons and brain surgeons and bone surgeons, right? And you just know what you've gone to in your life, but there's so much more out there that you might not realize is even a specialty, right? Like and I think that's what shows the maturity is saying, and that's why I think it's important to be part of something like the AAMC, is just knowing how medicine works. Like if you wanted to go into pediatric surgery, right? Like how do you do that? Are you a pediatrician or are you a surgeon? Like the answer is you have to be a surgeon and then you specialize in peds. But it's something where that might be really basic for me, but that's not always obvious for other people, right? If you want to be a pediatric cardiologist, though, you have to do pediatrics and then specialize in cardiology. You don't do medicine, cardiology, and then go into peds. You see what I'm saying? So it's important to sort of have an understanding of how medicine works and what the specialties are. And that's, yeah, you start broad because you might not realize some of the things out there. Like no one knows what you know, like I'm trying to think of like a more obscure field that might be fun, like in radiation medicine. Those guys do some really cool stuff. You have to like know all this nuclear physics, and you make like isotopes and stuff like that. And people may not realize that that's its own specialty. Or being a pathologist. If you're really into like some like CSI and bones and stuff like that, there's some cool things you can do with that. Um, that's an easier job if you don't like talking to living people. Um, but I'm just kidding. And looking at slides, but there's different things for different folks, and that, like, you might know that if you like to interact with people and talk to them, there's specialties that'll be good to you. Like radiology probably wouldn't be one of them, right? Because you're in a room looking at images most of the day. If you hate people, maybe that's a good one for you. So I would say just having some basic knowledge of what's available and out there, I think, is really important. It doesn't impress, as I said, I wouldn't, it'd be hard for someone to convince me that they really knew exactly what they wanted to, right? You guys are what, 22 years old, 21, 22. If you really thought you knew what you were going to be at 30, I'd be cynical about that. Again, what I want to see, that you care about people, that you're passionate, like you really love what you're doing. And it doesn't have to be medicine. It's what are you doing now? You're in a group, you're in a, leading a club at school, but like that, you enjoy it, you love it, you're putting your effort into it. This is something you're going to commit to, right? Because it's a lifelong commitment. You can't, it's really hard to change your mind after you've done this much work. So that's what people want to see, like a love for your field, hard work, and a commitment to something, and definitely showing that you care about people. That's where those aren't the times to be cynical and joke around, right? That's when you want to be very positive about all your interactions with other folks and how you want to make a difference in people's lives, right? Because you can do that in other fields, but that's really the special part of medicine. That's what keeps me going, and is a lot of fun. But definitely, one of the easier ways to show that is saying, it's not like, and again, it's easy if you have like the 99th percentile grades, it's easier. But if you're like 80th percentile and you're pretty good, how do you show up? How do you distinguish it? It's like once you break a threshold, it's good. But then I'm like, I'm looking, I'm like, whoever, Ariel or Dina, Shahar, if you guys are like showing me that you've done some other things and have had interest in your field, or whatever it is, and you're like, wow, they're serious, like they're not joking around like a regular student, or how I was at that age. They're getting involved, they've done this, they've done that, they're part of this society, they're getting informed, they know what's going on in the world of medicine. um you know That's where you don't want to get caught off guard, is someone asks you something that might be really obvious to us and part of our life, and you're like, excuse me, you know, oh, but I like crushed the MCAT. You're like, yeah, okay, you know, crushing the MCAT's good until you get your acceptance letter. And the day you get your acceptance letter to med school, no one's going to care about it ever again, which is sad. And then you have to worry about the next test. Then it's your USMLE 1, then it'll be your USMLE 2, then it'll be your board test, or your in services. It's there's always another one, and it's important. It's a separate skill, and it's an important thing to have. But that's what I'd say. I think that was a long answer.
Thanks so much for taking the time to answer. Any other questions from the group to put in the chat? Yes.
What would you give as advice for someone who's not necessarily so good at test taking, so is worried that, like, as you said, like, if you don't meet the cutoff, you're not necessarily going to, but I have other things on my resume or whatever, but I'm just not as good at test taking. What would be your suggestion or advice for that scenario?
For that, then that's when it's good to know people and show other things where someone can speak on your behalf, because as I said, from an admissions point of view, and you have a pile this big, the first thing you want to do is just cut the pile in half, right? And then you start going through an interesting, right? Because it's like you've done some amazing things that you're proud of. You just need someone to look at it, so if, and that's why it's like, usually there's just a low threshold. You get above the threshold, you're fine, and people look at it. If you're the top, it's easy. Then people may not even read anything else. But if you don't get to a certain threshold, you need someone on your behalf to say, hey, Todd, you know what? I have a good friend who's done all this amazing stuff and blah, blah, blah. I think she'd be really great. Can you look at that? Then I'm like, oh, okay, because now I have something else to go on. So I could reach back to that other pile and pick it up and look at it and say, maybe it'd be a good fit. Because everyone knows it's being like, the best test takers aren't the best doctors. Everyone knows that. It's a convenient way to lessen the workload. And it's not that you're trying to get out of work. Trust me. It's like, we love doing this. It's hard. It's like, you can't, I'd rather spend time reading your application, knowing that you're good and interested, than someone else who, maybe I'll get through it and you don't know. And it's the same thing. That's why personal statements, all those things are really important. And you want to be just very, you really want to be really honest and show something that's what makes you special. I'll tell you that for you guys. One of the bigger tricks or big mistakes people do when they start writing these things is they talk about someone else on their letter, on their personal statement. Like, well, I want to be a doctor because, grandma got sick and there's this amazing doctor who took care of her and saved her life or something, right? And that inspired me. When I read something like that, I just want to meet that incredible doctor that saved grandma's life. I don't want to meet you. No offense, right? Think about it. People do that. Like, maybe that inspired you, but that's not what you want to talk about. You want to talk about, in personal statements, the things that make you special, how you're going to save someone's life, how you can do it, how you've, whatever you've done so far in your career, you haven't probably saved anyone's life, but you've done something to change someone's life. You made someone's life better. What's it about you that's amazing? Because whenever someone tells that story, because trust me, I see a lot of this, is you get half the applications talk about someone who got sick in their family. Maybe they got sick and overcame, or mom got sick, or grandma got sick, or someone got sick, brother got sick. I will tell you this, every person in the world is related to someone who got sick and died. And none of them, and most of them are not doctors. That's not a prerequisite for going into medical school, knowing someone who's sick. And same thing, being inspired by someone who is amazing that saved them lives. That's a good story. Again, it doesn't tell me much about you, right? I'd rather know about you. What have you overcome? What are the challenges that you've faced? And that made you know that you really want to dedicate, because as I said, it's a long process. So you want to see people that can commit to something for a long time and care. But again, I know I tend to go off on tangents. The most important thing is, if you're at a level where it's, let's say, a middle of the road number, you're not doing that. It's trying to get in touch with as many people as you can that can tell someone, hey, do you mind taking a peek at that chart? or at the, sorry, not at the chart, at the application. Because then you can shine through. And that's why having connections is good. And that's why it's really important. You never know with any of these things. You raise your hand, right? Like you'd have no idea. Like if I didn't, if you guys are on the call, so you get to meet me, but like you wouldn't have known that I was like on a admissions committee at maybe one school or two. Now I'm on one, but and you can get advice from that. I'd say in general, piece of advice would be always think about what the other person wants, not what you want, and that's what you want to show them. It's important because otherwise you get caught up in the same thing. Like we almost joke about it. I'm like, here's another one about this. It's like you stop when you find something really different, or at least it starts out different. Like when I was in the national championship for something, you're like, oh, okay, grandma's not going to die today. Thank God. I don't need to hear that story again. Positive. I would probably also say, specific to this year, the big question, like what everyone asks everyone is, what did you do during Corona? Like it's going to be a standard question that everyone's going to ask, and the answer isn't, no one really cares that much. You're looking to see that you didn't just sit around and say life sucks and I was stuck at home and all I did was Zoom and I never left. No one, that's not the story, right? You want to say, despite all these challenges, I have overcome. You know what? Yeah, everyone knows all the bad things of Corona. Here's some of the good things. These are the positive things I've taken from it. And that's what people want to hear, right? That's why people like talking, right? No one wants to be on an admissions committee. In general, you don't get paid well for it. It's mostly volunteer work. It takes a long time. It's all, and it can be frustrating. It's like, why do you do it at all? It's because it's nice to be with optimistic people, all right? It's like the folks that are coming in and they're positive and excited, they have a story and you want to change the world. Like for me, that's like, it's a great energy to be around. And you're like, I feel better today, because it can be tough.
Gotcha. Thank you. Doctor, we have one more hand raised. I don't know if you have time for a final question. I know you have something coming up at 1:30.
Yeah, for sure. One more.
Dr. Schlesinger, thank you so much. I wanted to ask about you said the grandma got sick story. Is that, I feel like for a lot of people, it is a big motivation. Is that something you should include at all, or like maybe make like a really small part of?
No, I mean, it's not the story. It's how you tell the story, right? As I said, it's people get sick, and that can have an influence. And maybe it's someone closer. Grandma. I'm saying it in a little cold way, and I don't mean to. I'm just trying to be a little honest about it because it's important to that person, and especially if it's, let's say, someone a little bit closer, like a brother or sister or something like that, it can influence. But when you tell the story, don't tell me about the other people that took care of them. Tell me what you did to make grandma's life better. You see what I'm saying? You can throw in there a little bit, but focus on you, right? Because otherwise it's you're telling me about other people. I want to learn about you. I get that there are a lot of great stories out there and there are a lot of good things. And, you can say, you could put in there, there was this aspect of my life that made me want to pursue, see if medicine was right for me. But I don't need to know the whole story. Now that you got inspired, what did you do with that inspiration to make you the impressive person? Right? I saw so-and-so, whatever, grandma got sick, this guy did that. I was like, wow, this is amazing. How can I do, and I wanted to do something. So this is what I did, right? Because then, I leave a cliffhanger, because then maybe if I'm talking to you, I'll say, what happened? I want to know. I'm interested, You see what I'm saying? Just make it about you. I get that people put as I said, it's a common theme that you see. But it doesn't, but I want to read something about you that makes you special. Who are you? Tell me why. It's amazing, because that's what I'm saying. Everyone, I know it sounds weird, but everyone's had something bad happen in their life, right? what have you done with that? What have you done to make you special? So focus on yourself. You know, again, you don't have to leave it out. You could say, this happened in my life was a big deal. Or, you know, like one of our neighbors, you know, maybe a little older than you, had a very complex like allergy history. Poor things, like allergic to like 1,000 every kind of food and that. And it's been a really tough part of her life. And, you know, she wanted to dedicate her life to, you know, doing that. So she knows that's the specialty she wants to go into. But then, you know, so you tell a little bit of the story, but then you say, but you know what I did? I did research in an allergy lab and I did this. Plus, I have my own personal ideas about it because I've lived with this my whole life and I know what it's about. And then I've helped other people with the same problems I have, you know, and I started a support group at school and, you know, I joined an online thing or I made a webinar about it and I did this and I care about that and I'm going to change the world and I'm going to make it better because I'm special and I'm awesome and I'm passionate and I'm cool and fun and awesome. And that's why you need to have me work for you. You got it? Like that's what you want to put out there, because no one's gonna like, honestly, you get bored and have a page this big, you get through the first paragraph, you're like, next, you know. I mean, it's really like, you know, that's why you want to know why you had to take like English classes and in high school and all that, you know, the pyramid and all that, and the topic sentence and all that. It's for this moment. You don't want someone to get really bored really quick and just move on, you know. Good, at least he has good grades, you know. But again, because it's, I mean, just you put yourself in their shoes. They have more than 1,000 in med school. But if you had 1,000 applications in front of you with 1,000 pages of personal statements, why am I going to even read yours? Right? I mean, I know it's my job, but it tends to be a volunteer job. So what am I going to get through? All I have to do at the end is make a score. You know, I love them. I kind of like them. No way. Right? That's what they'll end up doing. You get some sort of scoring system on there. And so you want to be noticed, you know, and it looks good showing you know, being part of clubs, being leaders. And again, not just being a member of something, but being a leader in it. You know, you don't have to be president of something, be the secretary, be the whatever. It just shows interest, you know, and maturity. Good.
Awesome, Dr. Schlesinger. Thank you so much for making the time today.
Sure. I'll leave, you know, before you guys, I'll put my email on here for any of, that's fine. This is going, I don't know. We'll do this. If anyone wants to reach out on the Zoom, feel free to reach out. I'd be glad to answer any questions, help you guys out. All right.
Awesome. Thank you so much again. If you need some support, students, and you haven't yet visited the Shavit Glaubeck Center for that support, please reach out to us. If you have any questions directly related to the chat today, you now have a context to talk to Dr. Schlesinger. Anything outside of that, and you want that support, please come to the office. Otherwise, thank you very much. Have a great day and be well, everybody.
Nice meeting you guys. Good luck with everything.
Thank you.
Take care, everybody. Be well. Bye.